Hi, I'm Dr. Jeffrey Tucker, and there are so many patients that have tight hip flexors from sitting all day and just from being inactive. So it's really important that early on in my sessions, especially for my patients that have low back pain, I teach them a strategy to stretch those tight hip flexors. So one of the most simple ones that I have them do is right now I'm in a double leg stance. I just have them step back and keep that heel on the floor. I like feet straight ahead, and I start getting them to move the hips forward while they create this arm driver. Now, if they're a runner, this could be a great warm-up, just like this. I feel my hip flexor, my quad, getting a nice stretch. Get them to really work this, and if they do this for 30 seconds to a minute, it becomes a nice warm-up. Really move those arms, and the faster that you can do this, right, the faster that you can actually run. This is part of the engine. And here's what I want patients to know, that in this position, I have several choices. And I don't know how it is for you, but I have a lot of patients who have already bought these handheld vibration percussion devices. And the majority of my patients seem to have bought the Hypervolt 2. I really like this because of all of the choices of the heads, the speeds that are available, and I want them to be able to have the choice between this and actually being able to use the Viper Go or the Viper 3. This is the Viper 3. Here's the Hypervolt 2 Pro, and I'm going to show you how I can use this on myself. It has 3 speeds. I could be standing, and I want you to really get that I can target my TFL, and I want you to see what I'm going to do. I'm moving my pelvis slightly to the right, and I'm really working around that acetabular head where it gets tight. My runners really appreciate this because this helps resolve and heal knee pain that's coming from this tight TFL area. Now, keep in mind, a lot of patients have it, they just don't know what to do with this. So it's also an opportunity for me to really show them how to use this at home on their own. And you see what I'm doing? I'm going all along the anterior border, getting a nice stretch. I'm just weighted on this front leg. I can easily get my hamstring in this position. It feels really good. I'm getting the lateral hamstring tissue, the tendons, the bicep, femoris. Now I can get the area of the rectus. If I want to just move this arm along with it, I can. If I find a good spot, I can move an arm here. I can come across my body. You see these beautiful fascial stretches that I can implement using the device and working my fascia, my breath, my head posture, my spinal posture. Now, from here, as I turn this off, from this standing staggered stance, I can come down into half kneeling. This is one of my favorite psoas stretches. So I want you to notice what I'm going to do with my back leg. I'm going to take my heel and I'm going to move it outward. I'm actually going to move the heel laterally, and I'm getting a beautiful fascial stretch in my lateral gastroc. At the same time, I'm going to go at a little bit of a wider base with my front leg. I feel a nice stretch in through here. If I take my ASIS and lift it, as if I'm lifting my belt buckle, tucking the tailbone, resting my forearm on the forward leg, I can actually start arm drivers to feel an even greater fascial stretch. I can drop my shoulder down. You get the sense. You know the anatomy of the psoas. I'm working it from the inner pelvis area, the lumbar spine, right into the diaphragm. I find an arm angle where I feel it. I can shift my pelvis a little laterally. And again, if I want to use this tool, it's a great opportunity to turn it on and do some self-myofascial release. I feel a tight spot right here. I'm just going to leave it there 30 seconds to a minute. I already feel it relaxing. Again, I'm pushing my heel outward. I've externally moved my leg or abducted my leg. My glutes feel like they're being activated now, which is just fantastic. Gently going up and down. So that's the psoas. From here, I'll come up, I'll take a break. I like to give that a good 1 minute stretch. The next progression, if I need to get rectus, it's heel to buttocks. I like to roll past the patella a little bit, almost onto that distal femur so it doesn't hurt the knee. Here I am in a great quad stretch. I'm going to cross arm to leg. And again, I can do an arm driver to create a full fascial stretch. See how I can bring my heel to my buttocks? If they're tight, they might be like this, and they'll feel tremendous pull in that quad. And again, let's use our devices. This is the Viper 3. I could just foam roll the quad with this. Whether it's on or off, it might look like a plank pose. At the same time, after a minute of releasing this, I could easily go into TFL, transition onto the back, and get hamstrings or calves. Usually I'll work from the distal area, the calves, all the way up, rolling my feet in, out. Changing your toe positions is really important. Going all the way up into the hamstrings and doing that self-myofascial release technique. These are really great things to do at home. Remind your patients who already have a Viper 3 or the Viper Go how to use it, get the most benefit out of doing those exercises. Thank you.